Hi, I'm Dr. Mila Brujic, and thank you for joining me on the American Academy of Optometry Foundation podcast series. And today we have the distinguished pleasure of being joined by Dr. Gretta Gregg. Dr. Gregg, give us a little bit of a background on yourself and your background and your education.
Hello, thank you for having me on today. So I am currently a assistant professor at the Illinois College of Optometry. I graduated from the Illinois College of Optometry in 2019 and then followed by my residency in ocular disease.
Great school. You guys have such a good reputation, and I have a lot of friends that graduated from ICO. So today we're going to be talking about what I think is a pretty monumental and important paper, and one that, in my mind, really applies to every single practitioner. And that's PVDs and really delayed retinal pathologies associated with those PVDs. So Greta, give us a little bit of a background on the study and really the impetus for it and what the key findings were.
So what the study was based on, what the authors did is they used a registry and they looked for patients that presented with an acute PVD based on ICD-9 and ICD-10 codes. And they were actually able to include about 430,000 eyes in their study, which is one of the largest cohorts to date to assess and take a look at acute PVDs and the time it takes for a delayed retinal pathology to occur. So what they found in that general population is that about 2.5% end up developing delayed retinal pathology, which is consistent with other studies. However, they were then further able to say that it takes approximately 40 days to develop a delayed retinal break in the general population and about 51 days to develop a delayed retinal detachment in that general population. They were then able to use from that general population and take a closer look and see what patients would be considered high-risk patients, and what are those high-risk classifications that will lead not only to a higher incidence of delayed retinal pathology after that acute PVD, but also shorten the time for that retinal break or retinal detachment. So what they found in that population, the high risk, was about 6.5% that ended up developing a delayed retinal pathology, but the time it took for a retinal break to occur in those high risk patients was 34 days, and retinal detachment was 39 days. So
What did they consider a high-risk patient in this study?
So what they considered high risk were patients that either had a vitreous hemorrhage present with that acute
Mm-hmm.
PVD,
Makes
patients
sense.
that had a fellow retinal break or retinal detachment in their fellow eye,
Mm-hmm.
patients that had lattice degeneration, and patients with myopia.
Yeah. Did they use a cutoff myopia criteria, or was just anybody that was
So
kind of myopic was kind of put in that
Exactly.
bucket?
So that was kind of one of the limitations in the study is that they couldn't look into the severity. So how severe was that
Right.
victim, or was it mild, moderate, or more severe myopia that they noted?
That shows some of the pros and the cons with the registries. Because correct me if I'm wrong, but they're usually using ICD-10 codes, correct?
Correct. Correct.
Yeah. So again, now taking a look back at this, and I just saw this patient a month ago, somebody who I was seeing back for a PVD follow-up who called in sooner than the typical 4-week time period that we see them back for that follow-up, saying something's different with this. And it was one of these people, one of the 2.5% or 6.4%, depending on whether or not they were general population or high risk population. But what type of guidance does this give us clinically on when we should see these patients back and how frequently after that initial acute PVD we should be seeing them back?
So that's a great part of this study, kind of looking at this delayed time and giving us more of a time frame. It really does show that after that acute PVD for our general population, a follow-up kind of within 6 weeks would be appropriate. However, there's really not a kind of one size fits all approach for
Yeah.
those higher risk patients. You really need to assess what high risk characteristics a patient has and how many of those high risk classifications they have, with vitreous hemorrhage being the highest one
Mhm.
to lead to a retinal break or tear.
So I guess the bottom line is, Greta, just making sure that every single time we see that acute PVD presentation, we're making sure we're following up with that individual just to make sure that everything is in fact staying intact.
Correct, correct.
And then what would be the recommendation after that typically? Is there any type of time frame, or is it just kind of general eye care at that point?
So general, just kind of monitoring. One thing what they found in the study is there's that variability for follow-up depending on clinical findings. So for those higher risk patients, maybe seeing them back every 2 weeks and more frequently initially, and then kind of once you're in the clear of that typical time that it takes for that delayed retinal pathology, then kind of stretching out that follow-up sequence.
Greta, I think this is absolutely awesome. And I do think that this data is the type of information that really gives us good clinical guidance, not only to really solidify what we're doing in practice, but also to making sure that we understand the importance of those follow-ups. Because when you're seeing 97% of them that don't have any pathology 4 or 5 weeks later, you assume that everything's going to be okay, when in actuality, that few percent that happened to, we got to make sure we're catching them. Any other kind of closing comments to our colleagues on the findings in this study?
So just very important to take a thorough examination, reassess the patients, and then if you're ever kind of in doubt about those risk factors, just seeing them sooner than later would be the appropriate way to do that.
Well, Dr. Greg, thank you for joining us on this episode. And again, we'll make sure to have you back on a future episode. And thank you all for joining us on this episode of the American Academy of Optometry Foundation podcast series.
Thank you.